Hello, I'll be giving a report on my patient who's a 16-year-old male. The 16-year-old male presents with his mother to urgent care for complaints of worsening asthma symptoms. The patient's mother reports that her son's asthma symptoms have been exacerbated by an upper respiratory infection for the past 3 days. The mother reports today her son woke up in the middle of the night gasping for air, wheezing, and coughing. The mother reports that she administered his asthma inhaler twice. When that did not provide relief, she set up his nebulizer with an inhaled albuterol. Despite these treatments, they could not gain control of his symptoms. Mom reports that she measured his pulse ox at home and it was 93%. His contributing factors are a current URI with a mild fever, cough, and congestion. He has a prior history of asthma, which was diagnosed when he was 7 years old, along with a history of environmental and seasonal allergies. His current presenting symptoms is that he is struggling to provide a history due to shortness of breath, so his mother is providing the history. The patient is diaphoretic, leaning forward to breathe with audible wheezes, appears anxious, and has frequent dry coughing. Exams performed in the clinic was a focus exam. His eyes have allergic shiners which are present. His lips are dry and cracked. Lips and face are both pale. His trachea is midline. The chest has supra and substernal retractions. Lung sounds bilaterally, can hear loud wheezes during inhalation. The heart tones, he's tachycardic with S1 and S2 present. Diagnostic tests performed are a pulse ox of 92% on room air. His fingers are cold. Blood pressure is 120/80. Heart rate 101. Respiratory rate 21. And a temperature of 100 degrees Fahrenheit. The patient was swabbed for a rapid point-of-care testing for influenza A and B and COVID-19. All were negative. The assumed diagnosis is an acute asthma exacerbation. In the clinic, we gave 2 liters of nasal cannula while preparing the nebulizer. We administered albuterol with normal saline with budesonide and inhaled corticosteroid via nebulizer. The patient is not stable. His SaO2 came up to 93%, but wheezing is still present and still only able to say a few words at a time. We'll send the patient to the ED via ambulance to gain better control of his asthma exacerbation, where more invasive measures such as magnesium sulfate intravenously, imaging, and ABGs if needed. While planning to transfer the patient, I gave the report to the ED provider. I'm starting an IV, so intravenous access will be established. I will continue oxygen while waiting transport. We'll switch from nasal cannula to a simple face mask so the O2 can be titrated up. With a low-grade fever, I would like to suggest a CBC with differentials, a chest x-ray, a sputum test, and a test for RSV. Thank you.